Hi, this is Dr. Chris Doherty, the Agility Center in Bentonville, Arkansas. I'm showing you my technique for utilizing the Novostitch Plus for meniscal transplants. You can see I'm localizing with my spinal needle to get a far medial portal, as in this case, we're doing a lateral meniscus transplant in a young 27-year-old male. I'll also localize a far lateral portal, in addition to utilizing standard medial and lateral portals. This is going to enable me to get sutures at angles that I'm going to require for the meniscal transplant, as well as for shuttling the transplant itself into the joint. So laterally, I'll go ahead and place a traction suture into the capsule to make sure that I can get a good grip on it once I put my meniscus in place. I'll do the same thing for medial. Laterally, in this case, I've got a good wide open space to work with. If I'm working medial, I'll go ahead and trephinate that medial collateral ligament to give me excellent exposure into that medial joint. I use two different types of transplants. I'll use either bone plugs or a traditional trough method. I've used the commercial dovetail systems as well as creating just a simple old-fashioned trough. So here I'm going to go create the regular trough, and then I'll contour my meniscal transplant to slide into this trough. I use a couple different types of fixation for the tibia. If I've got a nice dovetail, I can use an interference screw, or I can use sutures over and through the transplant and out a tibial tunnel to help hold it down into its position. In this video, you'll see that I experimented with simply leaving the trough loose. I haven't found that it's any more advantageous than securing the transplant into the trough itself. So here we'll get a nice, good fit. And essentially all I'm really trying to do is convert the meniscal transplant into a large bucket handle tear. I prefer to pass the capsular side first and then the meniscus second. This allows me to be certain which limb I'm going to pass back up and underneath the meniscus so that I can retrieve it back up and over the top. And then I can just sequentially tie my sutures as I go. So you can see here I'm pulling the meniscus down and forward to retrieve with my suture retriever. And then I can grab my inferior limb, and then it's just a simple matter of suture sorting. You can pass multiple sutures if you need to, and then tie later. Once I've gotten one good stitch into my capsule and into my meniscus, if I've gotten good purchase, I can simply pull my traction suture, and this allows me to place multiple stitches. And I'll go typically every 5 to 10 millimeters on my suture passing to ensure that I've got good compression on my meniscus back to my posterior capsule. So you can see after I've gotten one suture tied, I've got good position. If I have to trephinate the medial collateral ligament significantly to give me good access, then I'll do that to make sure on the medial compartment that I can get good access in this tight compartment. If I'm utilizing bone tunnels, I can simply pull the plugs down into the tunnels. I don't usually tie them immediately. I'll simply wait till later, which gives me a little bit more freedom, but I'm pulling down on the bone plugs into the tunnels to make sure that I've got it snug when I first place my first sets of sutures. So here you can see we can simply tie, approximate our meniscus back to our capsular margin, and then cut our suture tails. My patient's in the supine position. The leg is in a simple figure 4. This is a little bit easier on myself in terms of work on the lateral meniscus. For the medial meniscus, I just leverage them against the post. I might have a footstool to help brace my leg on because this can be a little fatiguing over time. So once I've got my sutures placed, I can go ahead and pull my traction suture for the capsule if I feel like I can get good purchase. Otherwise, if I need to leave it in place, I can leave it for later. So here I'm going to go underneath the transplant into the meniscal capsular margin and go ahead and pass at the rim. And once I pass my first stitch, I'll back up a little bit, go ahead and pass my more central stitch, and then it's a matter of simple suture sorting. I do my transplants without the aid of a tourniquet, and I keep my pump pressure at 50 millimeters of mercury to aid my visualization. I'll use a radiofrequency ablator if I need to for electrocautery. I do not routinely put epinephrine in my bags. So for suture passage, I'll typically start posterior, work to the middle 1/3, and then work anterior. You can see I simply tuck the inferior limb underneath the meniscus, then retrieve back over the top, Utilizing the Novostitch Plus, I don't have to pass through a cannula. You just want to be careful with your suture sorting so that you don't offload your sutures. And then just simply tie back to your margin. So here I've got to undo a little suture tangle I've got, but this is no different than untangling suture within a shoulder. Once you become adept at suture management, this really speeds up the process. If you're unsure on your initial cases, go ahead and place an all-inside type device in or use one of the traditional inside-out passers. This will allow you to have a nice traction stitch to pull the meniscus back to the capsular margin. And also, if you feel like you need to go and complete the procedure with those devices, you could go ahead and do so. But utilizing this all-inside device, you can see that I can get very good access to my capsular margin and to my meniscus. So here I'm passing over the meniscus and then underneath the meniscus, because this was a pretty tight little margin here anterior to the popliteal hiatus. And again, if you can manage sutures, typically this isn't too difficult. You just keep track of your passes and which limb you need to shuttle through so that you don't offload your sutures. So here we go ahead and make our secondary pass, and then we'll just retrieve our sutures back out our portal and tie. As I move more anterior, it becomes a little bit more difficult to pass, so there's a simple trick for that. You can pass through the meniscus itself and then reach through the capsule through a secondary incision, just as you would be doing with the inside out technique. Or if you have good adequate space, you can pass both limbs of the Novostitch Plus, one underneath the meniscus and one underneath the capsule. I've got another video where I've passed on both limbs, but in this case, because the patient's so tight laterally, I'm going to go ahead and pass my meniscal limb first and then reach through the capsule to go ahead and retrieve the suture. So you can see here I am at my margin. I'm visualizing through my lateral portal. I've got an accessory lateral portal that I haven't utilized yet that I'm going to bring a suture retriever through, and I'm passing from my far medial portal with another secondary medial portal available to me to make sure that I can get the proper angle on passing this anterior horn. So you can see here I come in. I'm just going to extend my lower jaw beneath the meniscus and then pass one side. Again, in another video, you can see I could pass both sides, but with this geometry, I could only get one side in this patient. So I just use my secondary lateral portal to retrieve through my capsule so I can tie over the capsule. So we've got our one side passed, and you can see that I can't hit that anterior capsular margin from this angle. So I'll just bring a bird beak type suture retriever and grab this inferior limb so that I can tie over the anterior capsule. And then by moving to the lateral portal, you're able to get more anterior access to that anterior meniscal margin, and then again just retrieve directly over the capsule so you can tie that anterior margin down. And that's a simple matter of securing your bone bridge in place with either a screw, or in this case I had pull-through sutures, which is the same thing I use on bone plugs. You can tie over a commercially available button. I actually prefer to tie with the aid of an interference screw so that I can gauge better my compression. I don't want to over tighten them, so I've tied over an interference screw. You can see one of my sutures over the meniscus itself there, and I've got an interference screw in the tunnel so that when I pull it down into the tunnel itself, I've got the exact purchase I want on it and not too much. So that's my abbreviated technique utilizing the Novostitch Plus for meniscal transplant.